When life gets unpredictable, preparation matters. In medicine, it's all about staying alert, ready for whatever comes through the door. On the road, it's no different. That's why Volvo designs vehicles to help anticipate risk, reduce harm, and protect lives. The Volvo XC90's advanced safety systems inspire confident decisions wherever the road takes you. The Volvo XC90, for life. Proud sponsor of the Pit Podcast. Learn more at volvocars.ca/safety.
Story every parent, expecting parent, parent of a newborn needs to hear. This is a story I read this week in La Presse, and when I read it, did it give me a whole bunch of emotions. Of course, we Olivia and I, we welcomed our first child into the world just over a year ago. Now, reading in La Presse this week, this grieving Quebec family that is speaking out after their 4-week-old son died during a seemingly routine procedure at the dentist. Now, the baby had a minor intervention to release a tongue tie, but within minutes of the procedure, baby went into respiratory arrest. Baby parents say they weren't informed fully of the potential risks. It's our pleasure to welcome Dr. Sam Daniel, Chief of Surgery at the Montreal Children's Hospital. Dr. Daniel, thanks so much for coming on the show.
Thank you. The pleasure is mine.
And I know all the great work that you and your team do at the Montreal Children's Hospital. Now, I'll tell you, one of the reasons this story touched me so much is that I remember when our boy was born, we ended up going, to one of those clinics that you have for breastfeeding, right? And there was a nurse there, and she was like, "Oh, your child may have this, and you may need to go and get this." And it was this procedure to fix a tongue tie. And she's like, "Oh, I'm not so sure. Maybe it's borderline, blah, blah, blah. You got to look into it, right?" So at the end of the day, we haven't had to have that procedure. Everything's fine. But I said, "Oh man, what if we were parents that had gotten that advice to go do this?" So why don't you break this down first? Can you explain what a frenotomy, I hope I'm saying that right, or what a frenotomy is for infants, and tell us about those risks?
Yes, with pleasure. First, my thoughts are with the family living this tragedy. It's unspeakable what they're going through. And I don't know the specifics of what happened, but to explain what is a frenotomy, it's really a small cut to release a membrane that is underneath the tongue. That is holding the tongue and tethering it. So what is the effect of having what we call a tongue tie or a short tongue frenulum, hence the word frenotomy, is it's a membrane that tethers the tongue and decreases mobility of the tongue, which in newborn babies can create difficulty with latching on the breast and with proper breastfeeding. And I say can because in most cases it does not. So it's not because the baby has a tongue tie that automatically this should be released. Also, not all babies with feeding challenges or breastfeeding difficulties need necessarily a tongue tie release. So it becomes important to ensure that there has been a thorough exam of the baby to ensure that there aren't other reasons that are making the breastfeeding challenging. For example, nasal blockage or nasal obstruction. It's very hard for newborn babies to breathe through their mouth and breastfeed at the same time. At times, it's related to the positioning during breastfeeding, or and at other times it's related to other conditions like weak muscles or neurological challenges that can make swallowing or suction more of a challenge.
How common are things like this? Tongue tie, short tongue. How common is that in babies?
It is quite common, and that's why I'm emphasizing that it's not because there is a tongue tie or a short tongue tie that we need to do something about it. It is extremely unlikely for this to affect speech. That is a worry of many families that come to see me. They worry that it will impact the speech of the child, and I reassure them. When I look at teenagers or adults that consult for this, often it's related to a social limitation of sticking their tongue out as the tongue is tethered, or having sometimes food remnants stay under the tongue and giving them a bad breath. But when it comes to newborns that are having feeding difficulties, it becomes important that an exam is done by a health professional, pediatrician, lactation consultant, or ENT surgeons or other surgeons. This is a lot of times even done by family physicians in their office, or by pediatricians. So the procedure itself has been done for years and over 2 decades of teaching the procedure and supervising residents, fellows, and other physicians. I have thankfully never encountered such a tragic event, but it is a sad reminder that there is no benign procedure, and that every time a procedure is done, it's important that we understand the common complications, which in the case of a tongue tie, the most common complication is for scarring that the procedure might have to be redone, and even that is rare. Occasionally bleeding, and that is very rare, oftentimes related to bleeding history in the family or a predisposition to bleeding. At times you can get, again, very rarely infection or some slight discomfort after, but I have never encountered a tragedy where as described in the press.
And Dr. Daniel, just because we have to wrap up here, but I do want to ask you, if you're going to have to do this procedure, would you say always have it done in a hospital just to be as safe as possible? Because, I wonder if one of the factors here is where this procedure was done. Is it just safer to be in a at the Montreal Children's Hospital or in a hospital environment?
It's a great question in that this procedure is rarely done in a hospital. It's often done in an ambulatory setting. What I would say is important is wherever it's done, that there is expertise to manage a complication, even a rare complication.
Dr. Daniel, we're going to have to leave it there. Thank you so much for adding your insight on this. I really do appreciate it.
Thank you.
Dr. Sam Daniel is Chief of Surgery at the Montreal Children's Hospital.